So what we've been asked to cover today is the Wessex Health Partners Small Grant Scheme, and this is round 3 of our scheme. So would you like to go to the next slide, please, Ruth? So what I'm planning to cover today is just a little bit about Wessex Health Partners. We'll introduce the NIHR Wessex Experimental Medicine Network, go over the funding call and particularly the eligibility criteria. We'll talk a little bit about the themes that we're looking for and processes and timelines. And we've got at the end some top tips for a strong proposal and some contacts for you. So that's what we want to cover, but hopefully we will have a little bit of time at the end for questions. That's right, Ruth, please do carry on. So I'll work through these. Next slide, please. Okay, so I will talk a little bit more about Wessex Health Partners in a moment and who the partners of Wessex Health Partners are. But Wessex Health Partners has been established to support new ways of working. So this is things we haven't done before and ways of working we haven't done before. And part of that new way of working is to have the facility to run this small grants scheme. So what we have is some money that has been invested by each of the partners, and I'll tell you who they are, that create a pot of around £200,000, plus some money from the NIHR Wessex Experimental Medicine Network that Ruth will speak to, which is around £50,000. So a total pot of £250,000. And what we are aiming to do is run this scheme, as we have on 2 occasions beforehand, and award some small grants that are aimed at projects that will accelerate the impact of the Wessex Health Partners Strategic Alliance and support the activities that are aligned with the aims and themes of WEM. And you can see that whilst there is overlap between those two, the 50k is specifically for WEM, the 200k supports more general and can be experimental medicine, but not just experimental medicine. So that, I think more of that will become apparent in a moment. So we're going to go through today what this means and how you can access this funding. Carry on, Ruth. So I've said that the intent of money is to accelerate the aims of Wessex Health Partners, and the money has been put in by the partners. So just to give you a very high level overview, the partners that have created the Wessex Health Partners are, as you can see on here, so 4 of our universities: Bournemouth University, Portsmouth, Health Sciences University and the University of Southampton, and all of the NHS providers in Hampshire, Isle of Wight and Dorset, plus our 2 integrated care boards, and Health Innovation Wessex, our innovation and adoption partner. And all these organisations are working together in the research and innovation space. The idea is to combine that excellence that we have in those organisations, and what we really want is to accelerate the impact of the research and innovation that is done in the region. Next slide, please. So to give you a bit more information, so to help shape your thinking in terms of, well, what projects might we be looking for? So you can see there that mission, that's the common purpose that all the partners have signed up to, working together. So working in partnership. So if you're working in isolation, that's fine, but it's not the remit of Wessex Health Partners. This is all about working in partnership to accelerate those improvements in health and care through research, innovation and training. Specifically, ambitions are, we want to improve our region, and our region that we're talking about here is the Hampshire and Isle of Wight and Dorset region, which we call Wessex. So improve that region's ability to tackle those greatest challenges that are facing our Wessex health and care systems, and I'll come on to where you might have a better understanding of what those are if you don't already know. And then the second ambition is to generate greater collaborative interdisciplinary research and speed up that development from adoption of innovation at scale. So it's passing that baton between early discovery all the way through getting it into practice. We want to speed up that from 15, 20 years and get those benefits into the health and care system sooner. So quite broad, but these are things that external funders are increasingly looking for, and many of you will know that already. In terms of our strategic objectives, again, just might give you an idea of where our thinking is at. So one of the things that matches the ambition is connecting that research innovation to the health and care challenges in Wessex. So really understanding what those are, and I'll comment where you can find out a bit more about those in a moment, but that's what we're looking for. That collaborating to increase research should be obvious from the ambitions, but getting more of that collaborative research going on, that systematic translation of adoption into innovation. So part of this is learning, okay, how we might have an exemplar project that does that, but actually we would learn from that, okay, what worked, what didn't work, and how do we apply that to other things as well. Developing our workforce. So we are doing a piece of work already that's been funded to look at, well, actually how are early career researchers supported, and what are all the different avenues that they could go through, and try and collating that in one place. So that's an example, but there may be other ideas that you have. And enhancing the discoverability and information and data. So that's very much building on the Wessex secure data environment that you may already be familiar with, but what projects and what work needs to happen to enhance that even further. So those are the main ambitions and strategic objectives of Wessex Health Partners. As said, this funding scheme is looking at to accelerate the impact of this partnership. So we are very much looking for small projects that will sort of kick stuff off or accelerate stuff to achieve those ambitions. Next slide, please, Ruth. So over to Ruth to talk a bit more about WEM and the other part for the funding.
Yeah, so my name's Ruth Chalice. Some people in the virtual room will know me already. I'm working within the Southampton BRC as a project lead to develop the Wessex Experimental Medicine Network. And just to emphasise that WEM is a key component of the current NIHR Southampton Biomedical Research Centre funding, and the money to help develop and support activities of WEM are specifically to create opportunities to help exchange that knowledge and developing and increase regional collaborations in experimental medicine. And this small grant scheme is an example of, as Christine said, this is the third round. We ran 2 rounds last year, and so this is a third round of doing this joint funding scheme with Wessex Health Partners. And we've also been doing other activities, mapping capabilities and capacity in experimental medicine across the region, and helping support local events that are going on, or running workshops and forums, and expanding out things like this BRC Science Forum to have more accessibility across the region to those kind of opportunities. I think if you're internal, you might know a lot about the BRC infrastructures across the country, but perhaps even internal people may not know so much. So Southampton is one of a national network of biomedical research centres, and this is a competitive award. So we have a 5-year funding award at the moment, and certainly in each funding round, certainly in the last funding round, there were winners and losers. So it's not a guarantor that you've got an existing BRC that you're going to be successful in the next round, but we're very hopeful. We're planning already for the next renewal. And as I go through the talk, I'll mention our existing currently funded themes, and we have got some shadow themes that we're hoping may get funded in the next funding round and will be part of our initial funding submission. some people ask us about experimental medicine and the definition of experimental medicine. So this is a very busy slide, but what I'm trying to show here, and some of you may have seen this kind of slide before. So there's some people, and Wessex Health Partners themselves talk a lot about a discover, develop and deploy kind of pipeline from taking experimental medicine or new innovations through a pipeline into full deployment in the NHS. And those two top bars, the biomedical research centres and structures like the Experimental Cancer Medicine Centre, sit very much at the early pathway of this. As NIHR funding, as the Wessex Experimental Medicine Network is part of NIHR funding, this is all in the human translational space. So we wouldn't fund projects that are basic science further back in a preclinical pipeline, for example, in animal models or anything like that. It has to be either new interventions either in humans, so first in drug trials and that sort of thing, of course, but humanized models, human data models, but all in the human environment. And so the Wessex Experimental Medicine sits exactly in the same space, as it were, as a biomedical research centre or an experimental cancer medicine centre. And these TRC stands for Translational Research Collaborations. Those are collaborations across the country in certain disciplines. And there are more than what's just listed here, but listed here are the ones that Southampton is predominantly active in as these collaboration networks across the biomedical research centres. And then some of the other structures you can see below are just various different structures that we do have funding for in the Wessex area. And to highlight, as Christine mentioned, that Wessex Health Partners could potentially fund projects in any part of this discover, develop, deploy, where the experimental medicine is at that earlier stage. And then I think I'm back to Christine to talk about the funding overview for now.
Yeah, so just go to the next slide then, Ruth. So I've already mentioned there's 200k up to 200k in total available to pump prime activities, which accelerate the impact of Wessex Health Partners, and that further 50k for WEM. As this is pump priming, or sometimes we call it seed funding, we do expect most awards to be quite small. So we expect most awards will be less than 5k. Historically, we have given awards less than £1,000, or in that range between 1,000 and 5. Some awards of more than £5,000 may be granted, so that's not against the rules. But anything over 20 probably gets really quite difficult, because obviously it takes too much of the pot for one award. But the larger the award, obviously, as you might expect, the more compelling the justification. So if you are going to ask for larger amounts of money, you really do have to justify and have a really strong case as to why we would want to award that over multiple smaller projects. So not ruled out, but do make sure your application is really strong. Next slide, please. So eligibility, next slide. So in terms of eligibility, so applications must be led by one of the Wessex Health Partners founding partners. They are the partners that put the money into the pot, certainly for the Wessex Health Partners scheme. So, it's not surprising they would expect to lead an application. When I say must be led by a founding partner, what I mean by that, and I'll go back to the WEM part, but the lead application must be substantially employed by that lead founding partner, so referred to as the lead organisation. Now, for WEM projects, there's just a slight nuance for this, and because this comes out of Southampton BRC, so Southampton does already fund a number of projects associated with that for Southampton people. The project for WEM must be led by a WHP partner that's not UHS or UOS solely, although you can co-lead. What I mean by that is, if we just get an application, and Ruth might want to elaborate on this, but if we just get an application from a Southampton partnership leading this with no co-lead from any other organisation, that's not really fitting the eligibility criteria. Whereas if it's being led by one of the other partners and Southampton is a Southampton partner is a co-lead, that might be more acceptable, because what we're really trying to do is build that capacity, capability, collaboration in the other partners in collaboration with Southampton for WEM. And you might feel free to come back to ask questions on that. So for the rest of that, so lead applicants must be substantially employed, I've already said. Applications, we do ask for applications to be signed off by the Wessex Health Partners board member of the lead organisation, and in the guidance notes it says who that person might be. And that's quite important, because in the longer term, for the integrity of Wessex Health Partners, for that board member to know what's going on in their organisation and realise the value of all of this, it's important that they're cited on that, and will support you in that. Proposals fostering new collaborations between Wessex Health Partners and covering a wide geographical area are particularly welcomed. They don't have to necessarily be new collaborations. Some collaborations are now developing, so not necessarily new. But what I would say is, if it was something between Portsmouth University and Portsmouth Hospital, or solely, or Southampton University and Southampton Hospital, well, those are partnerships. Same for BU and UHC. Those are partnerships that kind of already exist. So you can get on with those. This is looking for something new and slightly different, and getting that pan-Wessex collaboration. And I haven't put on there, but interdisciplinary is also good. We will come to some top tips later. And applications, applicants must indicate how they intend to get that further funding. What's this seed funding going to take you to? Are you aiming for a programme grant? Are you aiming for something else, a charity or something like that? Or how you anticipate this project will lead to a defined impact. So that will be taken into consideration. Next slide, please. In terms of finance, this is for prime funding. We are expecting it to add value, and it is the responsibility, just as a reminder, that of the project lead or co-lead, if the one exists, to ensure that the costing is appropriate and liaise with those finance departments as needed. What we can't do is award funding and then you come back and say, well, actually we need to add a bit more. What you get awarded in the end is what you get awarded. And yes, I've already said applications for PowerPoint should indicate external funding streams that will be targeted in future. Ruth, carry on. Key themes. So in terms of the key things, we're still fairly broad at the moment. Obviously, the 10-year plan has been, and this is a health and care, health and academic partnership. So the 10-year plan is really important. You will know, I'm sure, that of the 3 shifts that they're looking for. So that is something that we would want to carry through to this funding stream. In terms of what the local population health need is, or what the challenges are in Wessex, Hampshire and Isle of Wight integrated care system and Dorset similarly have articulated in their strategies what the main challenges are in the region, and I would encourage you to go to those. We'll circulate these slides, and hopefully the links will work, because there's links on here that takes you to those strategies. But you can see the large areas, the top level priorities, and there's more detail underneath of those, of what their challenges are. Ruth, do you want to move on?
Yeah, so to come back to the Southampton BRC themes, on the slide in front of you are the currently funded themes. So we have 5 themes here, which you can see: perioperative critical care, lifestyle, nutrition, lifestyle, metabolism, data health and society, microbiology, immunology and infection, and respiratory and allergy. Rather than spend a lot of time in this meeting going through what are really quite could be very long talks in themselves on each of the themes. I've just put the homepage link to the Southampton Biomedical Research Centre that then links out to each of these themes, and also the BRC SMART objectives for all the themes. So that's a downloadable document which is also in the guidance notes for the funding call, so that hopefully you can relate to what might be in the SMART objectives of each of those themes. But I would encourage people to reach out to me if they wish. If you're not already integrated with one of the BRC science themes, please do reach out to see if we can find collaborations, if that's what you wish, and to check that alignment of your project. However, to emphasize, as I mentioned before, there are candidate themes that we are anticipating putting forward for the next funding round, and I've listed the 2 candidate themes that are likely to go into a next application. So brain health, experimental and applied neuroscience, which would cover areas of mental health, areas of dementia research, lots of different areas that I probably haven't covered within that remit, and also cancer early diagnosis and targeted treatment. So again, if you want more information, please do reach out and I'll try to link you with the relevant people. But we're also keen to support any experimental medicine. So those are the existing themes. It's great if there's linkages within that, because that really aligns with our current funding. But if your remit sits outside of that, that doesn't mean that we wouldn't be interested. So as long as you meet the other criteria of regional expertise and unmet health needs, then please have a chat with us about your project idea, or put an application together. The application form has been designed to try not to be too onerous, but please do reach out if you need support with it. Those are my contact details and the contact details for WEM. And then the application process timeline and deadlines. So obviously you're all on this call, so hopefully everybody's received emails about the call, but there is a website in the Wessex Health Partners pages that can be easily found on this scheme. And essentially, hopefully you have a nice research idea for this. As Christine's mentioned, we would encourage initial discussions with your steering group or board group member. So those are listed in the guidance. All the Wessex Health Partner board members and all the steering group members are listed in the guidance. But we do appreciate that within different institutions that there's lots of different interactions, and it may well be that your steering group member or board member steers you back towards us. So we encourage those conversations. You can approach us also directly. So this is the main email for Wessex Health Partners that applications will be submitted to, and it's a joint call, so they'll all go in together. And this is an email that I will monitor and can respond if you have a specific question around the experimental medicine network part. Again, as Christine's mentioned, please do contact your research department. So we've announced the call. The closure date is not till the end of October, but that will be a hard deadline, because last year we got I think over 60 applications, and we held it as a hard deadline. We didn't take any extensions or late submissions. So we're telling everybody nice and early, please contact your research departments. Please ensure you get the correct sign off from your board member and don't miss the deadline. So yeah, complete your funding application and make sure you get it in time. Do chat with us in the intervening months if you wish. And this is just a pictorial sort of diagram of what happens next, really. So we've opened the call on the 1st of July. It closes at the end of October. And then these red boxes are what we're doing in the background to assess the applications that come in. So there's a review panel that comprises of senior leadership teams from both Wessex Health Partners and within the Southampton Biomedical Research Centre to review the applications, and we'll go to external experts as required. So any WEM projects that do have an alignment with one of the academic themes of the current BRC will go to those theme leads or co-leads as well, and we'll have public engagement review of the projects, and all of those reviews will be collated in order to inform final decisions, which should be given to applicants. So if you follow this round, we hope to tell people an outcome by Christmas. So sort of second, third week of December, you should get an outcome. And then we sort of the ball passes back to getting the award agreement signed off between either Wessex Health Partners or the Southampton BRC for the WEM projects and the awarded lead institution, and then the projects can start. So I have been asked quite often, when should projects start? How long can they be? Other than some of the criteria that we've gone through already, a lot of the criteria are quite vague because we don't want to predict what it is you need. That's for you to come forward with the idea that will help your project to get that kickstart that it needs. Having said that, with the outcome decision being December, a lot of people put down a start date of something like January 2026, and a lot of people have maybe a 1 year duration of the project, but some are shorter, some are 6 months, some are a bit longer, and some might not have a start date that quick because of contractual delays, because of ethics applications that might need to go in. You know, it is quite variable. And then during the project, we would ask for some monitoring. So there's a 6 monthly report form that we just send you a form and ask for updates, and then a project end form. But again, both myself and the Wessex Health Partners are there to support. You don't need to wait for a 6 month report. If you want support during the project, if you want to reach out and get more collaborations, or if you have challenges, please do keep in touch. Is there anything you want to say to that, Christine?
No, I don't think. There's a couple of things in the chat which I think we'll cover in coming slides.
So I'll hand back to you for some top tips then.
Yeah, so top tips for a strong proposal. So do you want to so in terms of case studies, and Matt, thanks for the comment in the chat. These case studies are little vignettes on the Wessex Health Partners website, and we're building this catalogue up. So actually, I would encourage you to go over and look at those vignettes. But I thought probably what would be helpful is actually if I pull out some top tips that come from which are sort of generic across themes rather than a specific project. Projects can be quite specific but we'll move on. So Ruth, if you want to take us to the next one, I will go through those top tips. So I thought I probably would be helpful to tell you, what the panel will consider and the types of conversations that we have. So, some of these are pretty straightforward and totally obvious, but you would be surprised that actually people do trip themselves at the first hurdle sometimes. So in terms of what we consider, well, first and foremost, has the eligibility criteria met? That's a yes or a no. So and you will be able to see that on as I talked to earlier. The other question we will ask ourselves is, does the project address an area of need or priority? And what evidence, what narrative in the little bit of narrative that there is there, that it suggests that it does. You all know your areas really well. We've also given you a steer to what the themes are for WEM, and we've also given you a steer as to what the ICB priorities are. So does your project area sort of seek to address something like that, and potentially one of the or more of the 3 shifts in the NHS plan? We know this is a small amount of money, so it won't necessarily solve the problem entirely, but it's seeking to address that. So how strong is that bit? And it isn't a yes no answer generally. It's there might be a scoring system in there, and on a scale of 1 to 10 or a scale of 1 to 5, what does the panel think about that? The strength and credibility of plan to secure future funding or deliver impact. So have you've got a clear idea of where you're going for next. We do have some applications that have said, actually, I'm planning to do this, and then there's a funding call I know is going to come out, because it always does, in 3 months' time, and I absolutely plan to put in an application to that funding. And that's the sort of thing we will follow up on in the annual plan. Did you actually say what in your annual report? Did you actually say what you were going to do? And then deliver impact might be another one, because I'll give you an example for that, actually. In one of our funding rounds, what we know is we've got quite a lot of research and evidence in tackling obesity, and we know that Dorset, for example, have their own targets on decreasing childhood obesity. So we were able to put a little bit of pump priming towards starting off those conversations, and that's gone on to generating a plan of how they're going to actually deliver the interventions that are evidence-based to address that problem. So that's a sort of implementation one that we were able to kick off with this funding, but there also might be some early stage research. Okay. How will this funding add value? So, what's already going on, and this is actually adding value to what's actually happening. The obesity one, was one. Actually, the added value there is you've got a team in one part of the region busy doing something, a team in another part of the region busy doing something. They'll absolutely carry on doing the great things that they're doing. This added value by bringing those teams together and giving them an opportunity to do some joint work, which then has led on to a bigger programme of work. The strength in collaborations between the partners. So are the collaborators named? And because what we not overly keen on is lots of ticks in lots of boxes to say, oh yeah, I'm collaborating with absolutely everybody, but actually there's nobody named there. Is that collaboration actually real? It's we do appreciate it's quite easy to tick a box. So actually, if the collaborators are named, and if as we're reading the application we can see, okay, yep, this is a real collaboration, that is something that will be taken into consideration. And does the work link to other Pan-Wessex research and innovation in infrastructure and or initiatives? If it doesn't necessarily mean we take all this into consideration. So if it doesn't necessarily mean it's not funded. But actually, if we look at that and go, oh, okay, so that is linking to, for example, WEM is an obvious example, but it's linking to an ARC program for mental health. Or we know it's linking to the commercial research delivery centres in some way, or the Wessex research hubs, but other initiatives that might be going on. We've got a cancer research and innovation network developing. We've got a critical network that's developing. So it's, what else does it link to? Well, what we're trying to create is this thriving ecosystem. Appropriate involvement in those of wider stakeholders. So it is absolutely fine. The bid has to be led by a Wessex Health Partners Wessex Health Partner member, and have other Wessex Health Partner members in that. But if there are some wider stakeholders, voluntary sector organisations, or other partners that are important to this but not necessarily paying partners, that's okay. And if it's an appropriate level of involvement, that would be good. Plans for PPIE involvement and engagement. Actually, some of the bids that were funded last time were actually to fund PPIE, adding value to a project that people had in mind that they were working up themselves. So it's, we do have a section in the bid, and the panel will look at that to see how strong is that. And the financial justification and value for money. So they're asking for lots of money, but the financial justification is weak, and actually we don't think it's offering us a very good value versus something that, we can see that's really well thought through, lean, and will make a difference. You'd be surprised, we do get bids that say, can we have £20,000? And that's that. There's no more detail for that, what that's actually going to do. Just give us give us that. We don't really know what it's for. What is that going to be used for? Contribution to strengthening the Wessex Health Partners strategic partnership. So this is something that we do have to take into consideration. So all our partners put money into this pot, and bids are awarded on their strength. But if the funding got skewed, so for example, one organisation or a couple of organisations, had all the money and the rest of the partners, just didn't receive any money to support their initiatives, then they'll stop putting money into a pot in the first place. So actually what we've got to do is, there is some, and I think probably UK or I am told, call it tensioning between partners. So I do have to take that into consideration. What's the quality of the bid? And also how does this fall across the ecosystem? So it's the whole ecosystem is developing, not just one part of the ecosystem. And then lastly, the likelihood. The panel will discuss what's the likelihood of this accelerating the impact of Wessex Health Partners' overarching aim, which is for the benefit of the region. So all those are taken into consideration. There is a scoring system for how, and it's the narrative that's included in the bid that will speak to that, and what we'll draw our information from and judgment from. Moving on. I just wanted to share this with you because it's a good visual, and my thanks to the team in University of Southampton IFLS who have helped us with producing this. But this is from round 1. And it just shows you a network diagram of real collaborations that have been developing, and this is what we are aiming to do. The coloured dots are individuals in organisations, and how they're working more and more with each other. So this is the sort of thing we map and see how are we developing as a Wessex-wide ecosystem, working together. So we're looking to enhance this network through the collaborations that we're encouraging through this sort of grant scheme. Ruth. Okay. Contact and collaboration support. I want to move on. And I was thinking for this, probably the best thing I can do, and I know Ruth has mentioned this earlier on, is who the contacts are. But actually, I think the first thing to do is to scan the QR code here. That will actually register your and take you to the place to register your interest to receive the guidance documents and the application form. So the contacts are in the guidance document and that Ruth has showed earlier, but obviously they are on the slides there as well. And I think that's what we wanted to share in terms of slides, but now we did want to open things up to questions, because we're sure you have some.
So there's various, as you alluded to, various messages in the chat. I'm hoping that Matthew Harmer's one about talking through some successful applications, that you did address that point, but Matt, if you're still there, do you want to say anything further on that, or?
No, I think you've signposted to places we can go and have a look at examples. I suppose as you've had a couple of rounds, if there are common things that you see apart from the spread of partnership not being broad enough, that are common pitfalls that would be useful to highlight.
Yeah, so oh, sorry,
go
Christine.
on, Ruth. Go.
On the bottom of the guidance document, there are frequently asked questions, which we've tried to address quite a few of those, and that's also what Christine's been talking to. I did see somebody in the chat was asking for a site of the application form, so they were sent out for further dissemination through the partner organisations, but I have emailed you, Sue, with it, and alternatively that QR code, which is the website that I've put on the QR code that was shown in the last slide, and the website that's got a little heart next to it, that is where you can press the register button and ask directly if you haven't received the application form and the guidance documents. Sorry, Christine, did you want to say something as well?
I was interested. So Matt, I guess I put it the other way around, which was the top tips and what the panel is looking for. So I guess I don't know if that, I hope that does address. So I sort of flipped it around into do these things well, because if you don't do these things well, that is reasons why it won't get funded. And I guess we're building on that from the pitfalls of things in the past. So I hope that was covered. There are a couple of, so Liz, you've put a couple of things in the chat. So does the scheme include methodological research? Liz, I would encourage you to test the scheme for that. What I will say is, and I'm going to be candid with you, that Wessex Health Partners and the type of strategic alliance that we've formed in this region, there isn't a copybook for this. We are inventing it as we go along, and we're creating it, and the small grant scheme is that as well. So I actually think we're still at that stage where we're trying to work out, well, what works, what helps. So I would suggest, Liz, that it would be a really good idea. I hope the form is simple enough that you wouldn't have to spend too long on it. Obviously, I have given you some top tips that does say think about these things, a little bit more carefully, perhaps. But I would encourage you to just, work something up, because actually what it will do is make the panel think, oh, okay, is there something here that actually we should be focusing on? The other thing I would say to people is we do have the small grant scheme, but we do have other initiatives that are going on, and an annual plan that gets shaped every year. So sometimes things come through the small grants that we go, well, actually, that's not something we can pick up in the small grants, but there's obviously a common need here that we've got to address. So let's pick that up and take it outside and do it somewhere differently. So you're in a position where you can apply for funding in the small grants, but you can also influence perhaps the plans of Wessex Health Partners and WEM going forward in responding to actually what you need.
Great, thank you. That's really helpful.
Thank you, Liz. And can we link you to collaborators? Yeah, potentially we can. We do quite a lot of that anyway for external grant funding applications. So we are trying to do that more as we understand where the people are, and we learn more about all of the organisations that are in our ecosystem. We are increasingly trying to go, actually, yes, it would be a really good idea for you to link to so-and-so. And it may be we link you to the lead of something that then finds you the right person in that organisation, or we may know already the right person to go to. So we're quite good. We're quite keen on doing that ourselves anyway, because it helps our knowledge to know who's where doing what. There is a list. Ruth, that's yours. I was looking, what's the question that Ruth is asking? Are there any other questions?
We've just had a question pop up from Irina around, can external funding be from industry also? So that's yes. When I first read that question, I wondered if you were asking if external industries can be collaborators, which again they can be, but the focus is on bringing the capability and the collaboration connections into Wessex-based infrastructures. But then when you're looking for external funding off the back of collaborations, then that could be from any source, I think. So do you want to comment, Christine?
Well, Irina has popped her hand up and asked the question. So Irina, do you want to just expand?
To elaborate? Yeah.
So
yeah, clearly it's involving the Wessex Health Partners. It's going to be a Wessex Health Partner collaboration, but because the money involved may be above what the small grant is, and you already said we can apply for charity to supplement. Can we apply for industry actually to supplement if we are testing a specific, very new, innovative device that the industry is providing. So can we ask for, to make up for the whole project?
So I think, as a principle, we view industry collaboration as a very positive thing. I think the thing we wouldn't do was provide any money transfer to industry, unless they were providing a particular service that was needed, for that couldn't be provided by anyone else. But we wouldn't want money to go to industry. But if industry were a partner and bringing something to the table themselves, actually, I think that'd be great. And also, if you had your sights on applying for industry funding after this, that would also be great. So, yeah. We have got a question. Is there a minimum number of academic collaborators, or can it be one academic lead and other industry third party? I think probably I'm going to try and answer that, but sort of say academic lead part. What we wouldn't want, it might be one academic lead, but if all your partners were non-Wessex Health partners, so if it was, University of Southampton, and then all the rest of your partners were industry and third sector and not at all any of the other partners in Wessex Health Partners, that's a no. We would want to see more Wessex Health Partners collaborating on that first, as well as the other industry and third sector. But in terms of, it could be one academic lead working with somebody in an NHS organisation that is a partner, and then industry and third sector. But we would expect to see a few more than just one. Is that clear enough? Great, good. Thank you for the smiley face. Do we cover? Oh, sorry. Yeah, do we cover student, staff, student time? Yeah. If you can cost in a research assistant in that's fine. Yeah, that's absolutely fine. Anything else? No. Feels like we might have reached the end of the questions.
And save people 9 minutes before end of time.
Yeah. In that case, thank you very much for your time today. I hope we did it justice going through it, and good luck with your applications. We look forward to receiving them. So, and free for the rest of the day. Have a lovely, great opportunity. Thank you. Yeah, you're welcome.